Good afternoon. Hi there, this is Nancy Mason. I'm the director of the Muskoke Nation Youth Services Program, and just wanted to welcome everyone to our webinar today. I just want to go over a few things as we get started, and then we'll begin the presentation. If you're joining us via Zoom, you can communicate with us in two fashions. There is a chat button and a quick Q&A, so you can ask questions, and either one of those options will be responding to both. If you are joining us on Facebook Live, if you will post comments, if you have questions or comments, we will also be monitoring that, and we'll have an opportunity at the end of the presentation to get your answers for you. Again, we're glad to have you joining us for this presentation today. I want to tell you a little bit about our program. We're the Muskoke Nation Youth Services, and our goal is to empower Muskoke youth by connecting them to community, culture, and resources. We do that through 5 very different program goals. The first is fostering advocacy. We work with the Youth Council for the nation. We also try to provide other leadership opportunities and getting other young people engaged in having their voice heard. We work on providing resources. This webinar today is one of those. It's a resource for you all, as well as we have a really great list of resources on our website. And we also have a resource book that's available for free on download from our website, or you can also contact us and we can send you hard copies. Another program goal that we have is promoting civic duty. So this is really around getting young people to be engaged within voting, being engaged within their communities and knowing what's going on and how things that happen in their community affect them and throughout the nation. Another goal that we have is encouraging wellness, and that's probably where the majority of our programming exists. We try to do a lot of like life skills, cultural activities, just things that help young people to be well. We focus on suicide prevention a lot, and we partner with several different programs throughout the nation to help us to do that. And then our last one is creating support. Through that program, we have our brand new Muskoke Mentors, which is a pilot that we've been working on in the Wetumpka area, and just doing some mentoring, hopefully with some additional youth as we continue to grow. And then just providing that ongoing support for our young people that we work with, as well as for other programs that serve youth. So right now, I want to go ahead and turn the program over to our intern. We have a college work experience intern through the nation. Her name is Gina Powell, and we've kind of given her an assignment to work on this Cutkosen Yekvpetv project. And so I'm going to let her tell you about the project and some of the opportunities that we have available for you all. Thanks.
Well, day. As Nancy said, my name is Gina Powell, and I am a student for the college work experience through the Muskoke Creek Nation. Today I want to talk about our program, Cutkosen Nicotine. Today our presentation today will focus on providing resources, encouraging wellness, and creating support. Cutkosen Nicotine means little steps. This project is designed to provide you with the tools to help your children grow. The project is primarily for youth and young adults between the ages of 16 and 24. However, our webinars are open to all parents and guardians. For the parents in our target range, we offer assistance for planning for your future, connecting you to resources, providing additional education through webinars and workshops, and also providing parental support like diapers and wipes and other things that you may need for the baby. We have our Healthy Life Plan that helps you promote positive planning for the future of you and your child or children. And we also have our new text line, Little Steps, and this will provide you with weekly alerts that contain valuable information such as tips, links, and other support services. At the end of our presentation, I'd like to talk to you more about that program and if you'd like to be involved with it. Right now, I'd just like to turn our time over to Brandy to present our presentation today. Brandy Treagesser is a registered nurse, and she serves the public health of the Muskoke Creek Nation Department of Health. So I'd like to just present Brandy.
Hello, thank you for joining us this afternoon, and thank you to Muskoke Youth for inviting me to participate in this project. Today we'll talk about smoking during pregnancy and beyond. I know that a lot of times once we're pregnant, life takes a little bit different perspective. And so I just want you to know how the effects of smoking has while you're pregnant and afterwards with babies. So here we go. Maybe. Okay, there we go. Okay, so you wouldn't light a cigarette, put it in your baby's mouth and encourage your little one to puff away. Of course not. We have these beautiful little blessings that there's nothing on this earth we wouldn't do for them, you know. So I just wanted to share with you this next screen, because a lot of times when we're pregnant, smoking, we don't think about exactly what happens on the inside. We just, you know, it's very hard to quit, and we know that it's a habit that's very hard to drop. But if you can just think about what it does for babies, sometimes that can change your perspective enough where you want to seek cessation services. So the next slide I'm going to show you, there was a commercial back in the 1980s, very, very controversial. In fact, they took it off the air, but I'm going to show you, I don't have the actual video, but the picture was a fetus smoking a cigarette, and it showed the baby putting a cigarette in his mouth, a little puff of smoke, and they thought that was pretty controversial. But I really wanted to show this because this is exactly what you need to think about is happening whenever you're pregnant and you pick up a cigarette, because everything you take into your body while you're pregnant, baby gets first, and what's left over you get, whether it's food, whether it's nutrients, whether it's drugs and alcohol, whatever there is, baby's getting first. You know, it passes that placental barrier. So just think of this right here whenever you're struggling and needing to quit. Okay, so of course there are risks of smoking during pregnancy. Specifically for baby, there's a higher incidence of miscarriages, stillbirth, premature birth, low birth weight, SIDS, and then later in life, these kids are more likely to have asthma or other respiratory problems that can follow them through life. And this can all be prevented, because every little thing we can do to keep our babies healthy and happy, we're definitely willing to do. So first, I want to go over myths about smoking in pregnancy. And I've been a nurse 20 years, worked with moms and babies for a vast majority of that. And every one of these myths I've actually heard someone else speak about, they've asked me about. So just in case you or someone you know may have some of these, may help you a little bit to talk about it. So first excuse or myth, I'll be more stressed out if I quit, and that's not good for the baby. We know smoking, to quit smoking is not easy, can be stressful, but just remember that smoking a cigarette is much more dangerous than being stressed out. Once you can quit, those cravings go away. Cravings cause stress because you're worried about when you could have your next cigarette, and whenever you can stop that, then you definitely will feel less stress. It's a process, doesn't happen immediately, but it definitely is good in the long run. So here's another one. My baby's okay. She's in a little bubble. Smoke can't get in, and that's true. But whenever you smoke and babies in the uterus, it's like putting them in a smoke-filled room for 15 minutes. You know, or a car with all the doors closed, windows up for 15 minutes. That's a long time, and we would never do that intentionally. Because you have to remember, babies share a bloodstream with their mother. And so whenever you smoke a cigarette, all of those toxins go through the mom's bloodstream. That's why we get that feeling of euphoria or that you feel whenever you smoke. Baby gets that too. And there's over 4,000 harmful chemicals in a cigarette. And whenever they get these toxins, their little hearts are struggling to get oxygen. And when their hearts aren't getting oxygen, the rest of their body isn't either. And they're just in a constant state of growing. And so we don't want to interrupt that at all. Okay, we talked about low birth weight. And I've heard someone say, if my baby's too small, it'll make birth so much easier. Well, you know, the birth process might be a little bit easier, but we have to remember that small babies are weak babies. Small babies stay in the hospital a lot longer. They have respiratory problems. They have vision problems sometimes. They really, really have a rough go at the very beginning of that. So they can definitely have some serious complications. So we definitely don't want to believe that if they're smaller, it'll be easier. Okay, if I quit, I'll get fat. Nobody wants that. Of course not. Because sometimes whenever you quit smoking, you go to eating because you're just kind of replacing one habit with another. But while you're pregnant, that's the perfect time to eat healthy snacks. Instead of smoking a cigarette, take a walk because that's good for you, good for your endorphins to release when you exercise, keeps you in good shape. And when you have baby, if you were to breastfeed, breastfeeding really helps you to shed the pounds and boost your metabolism so that you get a double good there. Okay, my mom smoked with me and I'm okay. So I really don't see a problem. Many of us have parents that smoke. But remember, it affects everybody differently. You know, just because you didn't have any problems or born early doesn't mean that your baby won't either, because that's not a genetic trait that's passed down. Smoking is responsible for 40% of infant deaths in the United States. That's astounding. That's almost half of infant deaths were caused by smoking. And that's definitely something that we can prevent. I'm already 6 months pregnant. It's too late to quit. I definitely have heard this one. It's never too late. It's never too late to quit. Even in the very last few weeks of pregnancy, if you can stop smoking and replace that with a healthy habit, your baby has that much better of a chance to come out with no problems, less problems than if you were to smoke the whole way. So if you think that, you know, I've already gone this far, what's a few more weeks or months, change your way of thinking, because it's definitely never too late. I'll cut down instead of quitting. Well, that's definitely a good first step. You know, quitting cold turkey is very difficult, and you could definitely cut down, but remember that's still very, very, very harmful for your baby, but definitely a good first step. Smoking is me time. I can't give it up. We all need me time. Me time is good for us. It's good for our mental health. And we know while we're pregnant and soon after, we have a lot of hormones. Things strike us different. But think of it in the way of use the money that you would have used to buy cigarettes and save it up to treat yourself for a massage or a pedicure or a piece of clothing that you really want. Save for something big, vacation, something like that. Because if you were to step back and see how much money you were spending on cigarettes, you probably would be surprised. Find a new reward instead of a cigarette. You know, replace that with something else, a healthy snack, like we said earlier, or a walk, something that makes you feel good. Maybe it's watching a TV show by yourself while someone takes care of baby, something like that. There's options. Okay, this is definitely one we hear a lot. E-cigarettes are better. I'll just smoke those. The thing about e-cigarettes, and that can be a whole nother topic, is they aren't tested for safety. You know, cigarettes, we have a long history of research and being able to evaluate people that have smoked for a very long time. With e-cigarettes, they're essentially pretty new. They're not brand new by any means, but the safety is just unknown. And what we do know about it is it has a whole nother set of its own problems. They're not proven to be safe, even if they advertise that they are. And these devices usually still have nicotine and other toxic chemicals, even when they say that it doesn't. They do. And so I don't think because you're not smoking an actual cigarette with tobacco in it that that's a better option, because it's still, for you especially, not very good at all. And it still has traces of those things. Okay, so here is a 3D ultrasound. The top 3 pictures is one baby, and then the bottom 3 is another baby. And I wanted to show you this. It was a video that I watched, and I thought it was very interesting because the baby on the top, mama smokes. Mom smokes a pack a day. And I believe these are approximately 6 or 7 months along. And if you'll notice, baby's very guarded. The baby's moved around a lot, like they were more anxious. very excitable and always guarding their face. That's not a relaxed pose. If you were just kind of sitting there chilling out, that baby at the bottom, mom doesn't smoke, never has smoked, and he's just kind of hanging out there waiting for life to happen here. They're very calm, relaxed, show signs of relaxation, but that baby on the top is definitely going through something. Okay, about 1 in 4 pregnant Native American women during pregnancy are smokers. So we don't like to be part of that statistic. We want to make that statistic lower. If we're going to be at the top at something, we definitely don't want it to be this, but it's very, very common, but it doesn't have to be. So why is it so dangerous? Tobacco smoke contains more than 7,000 chemicals. One place I read 4,000, but hundreds of those chemicals are toxic, and around 70 cause cancer. These are things that we are knowingly put in our body if we smoke, and we're definitely taking a risk for us and for baby. So just to kind of break it down, here's some of the cancer-causing chemicals. We have chemicals used to make pipes, gasoline, some things that are radioactive, used to embalm bodies. These are things that are in just a regular cigarette, nothing fancy. Also, there's poison gases, because whenever we light a cigarette, it's a chemical reaction. We have gases in there that are used in chemical weapons, paint thinners, lighter fluid, car exhaust. That's definitely not something we would knowingly put in our body on purpose, much less all of that together. Toxic metals, even, you may not think about that, but arsenic, that's used in pesticides, chromium to make steel, lead, which we know lead poisoning is a very bad thing, and then the toxic metal to make batteries, cadmium. I never realized until I started doing this line of work that there were so many things in a cigarette. It's not just tobacco when it's a commercially grown product. Okay, so smoking cessation. We know that to quit smoking is not an easy process. It's a very difficult thing, and I commend anybody that can successfully stop smoking for any duration. The 1-800-QUIT-NOW is Oklahoma helpline that assists with smoking cessation, and they have a program specifically for pregnant women. So if you call and let them know that you're pregnant, they can assist. They give you counselors, some life coaches, resources. They send you things in the mail, and then after baby comes, they can help you with like the nicotine replacement, things like patches, gum, and such like that. So that's a great program, but you've got to ask for it. Okay, so this beautiful baby is born. We are just in love. We are in awe. Just can't hardly believe what a miracle it is. We say you may have stopped smoking while you were pregnant. It's really easy to pick it back up because you're thinking, okay, I'm not pregnant. It's just me. And for some reason, we don't care for ourselves as much as we do for our little babies or our family. But it's very important. Let me show you why. I love those pictures. They're so sweet. Okay, so why would you pick up smoking again? Well, quitting sometimes temporary. Stressed out. We've got this new baby. No one's sleeping. You have other kiddos, life is stressful. You think about job and work, recovering. Moms may feel like they're not quite themselves until they get into those routines that they had before. Social circles, you're in places where you smoke, like a casino or places that you may have gone before. And also if you have a partner who smokes. So it's very important that dads understand quitting by yourself is hard enough. When you have to sit there and watch someone or smell someone, that's near impossible. So I would suggest supporting your moms because they're really working hard anyway. So I like my little, who says smoking kills? I'm 42 and doing fine. Yeah, it does, definitely ages you. Okay, how can we quit and stay quit? So one major thing is tell people you're going to quit. That makes you accountable. If you say it out loud, then you have family and friends that can help support you. That's definitely something that you will need. create smoke-free zones in your house and car. Make sure there's not a lighter in there. There's not a pack of cigarettes. There's not any butt cans, anything like that. Take all of that away so that temptation to reach for it is just simply not there. You may see if nicotine replacement therapy is right for you. 1-800-QUIT-NOW can help with that. Your primary care provider can help with that, and see which options, because there are definitely several different things that you can try. And of course, calling that quit line, speak with the trained counselor, let them know what you've got going on in life, because they'll call and check on you, and they offer some of the best support that you will get anywhere, definitely. And whenever someone quits smoking, family is usually very proud. And so we like those proud moments. Okay, so what does it do to baby? Once babies are born and we've smoked during our pregnancy, they go through nicotine withdrawal. And you may not realize that's an actual thing, but when babies are born and that constant stream of nicotine is gone, they go through withdrawal symptoms, sometimes similar to babies that were born to moms that were doing heroin or crack, because all of it is just not there. Even just casual smoking here and there occasionally will harm a fetus. So it doesn't matter if you do it once or 500 times, it's still not good. These babies that are born to smoking moms tend to be more jittery, more excitable. They cry a lot more. They're stiff and rigid, which is a sign of anxiety in a baby. And they're just a lot more difficult to console. So think about that when you take this baby home. We want those babies that are going to sleep and they're happy and they feel good. But going through any kind of withdrawal is difficult on the human body, much less these little precious babies that just came into the world. And they also show stress in their central nervous system with, being rigid or excitable. Their gastrointestinal, which is their tummy and their poop. It could mess that up, and even their vision. The eyes are the very last thing to develop in a baby. So that's why when they're born early, they have eye problems sometimes. But the nicotine can definitely affect that eye development while they're in the womb. Things you may not think about. Okay, so secondhand smoke. We all have heard of secondhand smoke. We all know that it's dangerous. Causes lots of health problems, infants and kids. It can cause asthma, respiratory infections, ear infections, SIDS, ear infections apparently twice. And so that's not good. Even if you're smoking in the car, baby's in the backseat and your window's down, they're still getting secondhand smoke. Even if you're smoking in your house, but baby's in its room with the door closed, they're still getting exposed to some kind of secondhand smoke, and that's just not good. But have you ever heard of third-hand smoke? This is something that we don't hear a lot about or talk about, but what in the world is that? So third-hand smoke is the nicotine residue that remains on surfaces. So when you walk into somebody's house and you smell smoke, or you go to a hotel room and you can smell smoke, that's your third-hand smoke. That's the tar and the nicotine that sticks to the walls and the paint and your curtains, carpets, clothes, furniture, floors, even your acoustic tiles, like in an office building. And the reason I say that is, if you're a smoker and you go outside to smoke, you shut the door, go smoke, come in, wash your hands. The second you pick up your baby, if you haven't changed your clothes completely, you're exposing that baby to third-hand smoke. You know that you can smell a smoker when they come in, even if they're smoking out in the, in the wide open. So that's something to definitely take in consideration. And there's a reason that infants and kiddos are at a greater risk. They breathe faster naturally, 40 times faster than adults. Our respiratory rates are usually very slow, between 12 to 16, 12 to 18 is normal. But babies are, they're breathing 40 to 50 breaths a minute. So they're taking more of that in, that third-hand smoke, that second-hand smoke. So their exposure is much more than an adult would be. They also put everything in their mouth, everything that they touch. So if they're touching something that has that third-hand smoke, they are transferring it right to their mouths. We hold them close to us if you're breastfeeding, or if you're just holding the baby, or anything you're doing. If you're wearing clothes that you have smoked in, you're exposing that baby to that third-hand smoke. And it's just not something that we hear a lot about. And also they have greater absorption through the skin. Their skin is much more sensitive. It hasn't had any time to get thicker and denser. So they can definitely have a more of an exposure. Okay, so I'm circling back around to the 1-800-QUIT now because they actually, especially for you that have partners that smoke, they have a program specific for Native Americans as well. So we know that commercial tobacco is not a Native tradition, and they have special services to help with this. They have a whole other set of money and things that they can offer people that are Native American and smoke. So if you're Native and you're pregnant and you're smoking, this is just another reason to reach out and get this resource. So definitely they do a lot of outreach and such like that, which is just great. Okay, so here's my references. I want to do a quick little plug for my program here at the end. Like I said, I'm a public health nurse for Muskoke Creek Nation. I manage a program that is specifically for mother babies. We do home visits. To qualify for the program, you must be Native, pregnant, and have a history of some kind of substance use, tobacco included. If you're a former smoker, current smoker, that would qualify you for the program. I do monthly visits while you're pregnant. We do education, case management, make sure you're getting to your appointments and seeing if there's any resources that you need. Once baby's born, I'll continue to come every month, every other month until baby is 2. I'll bring diapers and wipes and other kinds of goodies for baby while still making sure, doing well checks in the home, making sure that baby's hitting those developmental milestones, assessing mom for postpartum depression once babies are here. We do have a lot to offer. So I've put my phone number and my email address there at the bottom. It's a voluntary program, doesn't have to have a referral from one of the clinics. You don't even have to be a patient with us here at the health system. But I wanted to share that with you at the very end here.
Okay. All right. Thank you, Brandy. That was very powerful and very informative information on that. And thank you for those Quit Now. It's good to know that they have programs specific to pregnant women and Native Americans. That's, I didn't know that. So I like that. But when our webinar, like I said, thank you, Brandy. Thank you again for that information. So when our webinar closes, you will see a link to begin a survey to give us some feedback. We value your input so that we can continue to improve our services. Yes, before I go on, I forgot to ask, is there any questions for Brandy or about this smoking program or about her program or any questions about that? Sorry. If you have any questions, feel free to call Brandy. I think that maybe she can put her link on her phone number in the chat line, and maybe you can get a hold of her that way. Or you can call youth services to get some information, and we can send it on to Brandy, and we can get you linked up that way with her. So as I said before, we value your input. So if you could, at the end of the webinar, to see that link and begin that survey to give us some feedback, so we can continue to improve our services to help you all. And if you are pregnant or parenting and are between the ages of 16 and 24, and you would like to be involved with Cutkosen Yekvpetv, the Little Steps program, please contact our office, and you can speak to me, Gina Powell, or you can speak to Nancy Mason. And I'd also like to remind all of you watching today that if you would like to receive parenting information, to text LTL steps to 81010. And if you sign up for the text line by the end of Friday, you would be entered in a drawing to win some awesome prizes for you or your baby. And we also have some future webinars coming up. The WIC program will be providing our next presentation on Wednesday, August 13th. And the TANA program will be on August 27th. So don't forget to register for those. Both presentations will be held at 3 p.m. and you can register by going to our website and looking at our events pages. Mado.
Hey, Gina, real quick, I just want to make sure that folks know that they need to put that at symbol when they text that in. So it's at LL
Okay.
step to 81010. You can see that there on the screen. If you are listening right now and you're one of those young people who's pregnant or parenting and you're ages 16 to 24, we would love to hear from you so that we can tell you more about what our program can offer to you as in support. Definitely also, we want to make sure that you complete the evaluation at the end. That will give you credit. So if you've already said, hey, yeah, we want to be a part of that program, you're going to get some baby bucks for attending today so that you can put those towards other items that your baby is going to need. So make sure that you do the survey. That'll get you credit for watching today. I'm going to go ahead and show you our website information there that Gina was talking about. That's how you can reach us. Through our email, phone number, there's our website. If you go to the events page on our website, the upcoming webinars are listed there. They're actually the same link that you registered with today. So that makes it a little bit easier, but you can go back to our calendar if you forget that. And then we're on social media with the hashtag, or no, sorry, with the handle of @Muskoke Youth. So feel free to catch us there. We try to advertise a lot of information and resources that are going on. But like Gina said, please sign up for that text alert because we'd like to give out some prizes for the people who sign up before the end of the day tomorrow, Friday the 31st. Thanks again for everyone for attending. Brandy, thank you for being our presenter. It was a great job. I learned a lot of information from you today, things that I just didn't even know, being an old mom that I am. So appreciate you for sharing that with us. We hope to have you back again soon, and we hope that we'll see all the rest of you as viewers in the future. Have a great day.